How do you decide how much proton activity to give a patient?
That takes several years of training to figure that out, but for the particular patient, what we use is something called a computer treatment planning software. So let me unpack that a little bit.
Good.
You have a computer treatment planning system, which is a planning software program that takes in the X-ray information, the CT information, MRI, PET scan, all of that information we put into one central place. We can use that to determine where the tumor is, and we can also use it to determine how to get the protons to the tumor.
So you're going to have to angle the protons or bring them in from a certain direction.
Yes.
And you're going to have to place the patient in a certain position also?
Correct.
How do you get the proton to the patient's tumor?
So it starts with putting that hydrogen atom in the cyclotron, accelerating it to 2/3 the speed of light, kicking it out towards the patient room, through those magnets that bend it into the patient room, and then ultimately out a final magnet that directs it precisely to a location in the person's tumor.
So if we've got a tumor that's, let's say in the breast, that's in front of the heart, because of where the breast lies, what are the advantages of treating an area in the breast with proton treatment and staying away from the heart? What are advantages?
Well, the biggest advantage with protons stems from the ability of protons to stop. When you accelerate those protons to 2/3 the speed of light, like we talked about, they come in through all the tissue, really not causing much damage at all on their way in, but when they hit the spot that we're targeting, they just stop and unload their energy. So we can use that to our advantage and deliver radiation to the breast tumor or the breast tissue without it passing through to the heart.
When you treat an area in the body with proton therapy, how frequent is the treatment? Do you just do it one time and that's it? Or do they come once a week or once a day? How often do you come for treatment? How long?
All of the above. So once a day or one time and then you're done is an option for some patients, and sometimes that's the best way to get the tumor treated. Other treatments take 7 or 8 weeks. It's generally once a day, Monday through Friday. The treatment takes about 2 minutes for each beam. It may take about 30 minutes altogether between setting the patient up, which takes a lot of work, requires a lot of precision before we turn the beam on. And then sometimes you're seeing the physician as well after the treatment just to make sure everything's going okay. And then usually you're on your way home in less than an hour.